Evening, everybody, and thank you for joining us for session 6 of the Climate Ready Classrooms Public Health Faculty Development course on climate change. This session is on extreme weather, disasters, and public health emergency risk interventions for flooding and waterborne diseases. I'm Dorothy Biberman. I am the Senior Director for Global Engagement and Executive Initiatives at the Association of Schools and Programs of Public Health. And I also support the Secretariat for the Global Network for Academic Public Health, which is one of the co-sponsors of this session. A few housekeeping notes. Closed captioning is available. For English, please press the CC button in the bottom of the Zoom window. And for Spanish, please click on the link in the chat. As I mentioned, this is session 6 of 11 sessions that make up the full course. We do have several course objectives. The first is to equip public health faculty with a deep understanding of the science of climate change, its drivers, and its direct and indirect impacts on health, enabling them to confidently integrate climate health concepts into existing public health curricula. Second is to prepare educators to guide students beyond theoretical knowledge toward applied skills in risk assessment, health systems resilience, community engagement, and evidence-based interventions. For our learning objectives for this session, we have to explain how climate change intensifies weather events and disrupts the hydrological cycle, affecting water availability and quality, to identify short and long-term health risks from extreme weather events, water scarcity, and water contamination, and outline health professionals' roles in reducing these risks, to understand how biological, social, economic, and structural factors can heighten vulnerability to extreme weather hazards and waterborne diseases, to identify the role of public health professionals and strategies for disaster risk reduction, early warning systems, public health communication, and regional cooperation in preventing health impacts and minimizing forced migration, and to apply knowledge of climate impacts on waterborne pathogens, including those listed here, to improve disease prevention and response strategies. This is a 90-minute session, which will include 1 lecture and 2 case studies. At the end, we'll have a question and answer section. Please enter your questions for the presenters into the Q&A box at the bottom of your screen. Please do not put your questions in the chat. Attendance can be tracked synchronously and asynchronously. For synchronous attendance, your attendance will be automatically recorded when you join the live Zoom session using your personal Zoom link. Attendance will not be counted if you use a colleague's link or join on YouTube. And for asynchronous attendance, you can watch the session recordings on the Columbia Plus Canvas platform, where your viewing will be logged and counted toward your attendance record. Please note that you must use the same email address as you did for registration. A certificate of participation will be available to all participants who attend at least 8 of 11 sessions and pass the final exam with 70% or more. Please consider joining the WhatsApp group for this session or for this course, where you can get additional information using the QR code here. And with that, I am really honored to introduce our 3 presenters for today. Our first presenter for our lecture is Dr. Virginia Murray. She is head of Global Disaster Risk Reduction at the UK Health Security Agency. Second, we have a case study from Dr. Anne Dorothy Slovic. She is a research supervisor for Global Health and Sustainability Program at the University of Sao Paulo School of Public Health. And finally, another case study from Dr. Marija Jevtek, who is a full professor at the University of Novi Sad Faculty of Medicine and Institute of Public Health of Vojvodina. And with that, we will get started with our presentations. Unfortunately, Dr. Murray was not able to join us in person today, but she has provided a recording of her presentation, so I will just get that queued up here.
Dorothy, we're not hearing it, I don't think, on our side.
Oh, okay, hold on. Sorry, just let me try this one more time. Maggie, I'm sorry to say that the option to share my video or my sound is no longer appearing.
Okay, I can try to pull up the video.
Okay, thanks. Just bear with us for 1 minute, everybody. Sorry about this technical error. No, no sound.
And the climate ready classrooms. I am so delighted that the Public Health Faculty Development course on climate change is now happening. It's such an important course, and it's a great honour for me to be involved. My name is Virginia Murray. I'm Head of Global Disaster Risk Reduction at the UK Health Security Agency currently. But I'm also a member of the WHO Collaborating Centre on Global Health Security and co-chair of the WHO Thematic Platform and Disaster Risk Management Research Network. And I'm chair of UNDRR and International Science Council Steering Group for Hazard Information Profiles and all sorts of other things. So I'm very honoured to be asked to talk about extreme weather, disasters, and public health emergency interventions for flooding and waterborne diseases. I hope this will be a useful talk for you all. How did I get involved? Well, I had the great privilege to be invited to be a coordinating lead author for the Intergovernmental Panel on Climate Change Special Report on Managing the Risks of Extreme Events and Disasters to Advance Climate Change Adaptation. I was responsible for Chapter 9, linking across all the other chapters, and we published this in 2012. It was the most enormous effort. And of course, it addressed drought, as you can see from this image, but it also addressed flooding, heat waves, and many other things, because we know that climate change is a real issue. So let me just share with you what we did with this. I came back to the UK, having done all this work, and said to my then bosses and said, we need an extreme events team. We have to have it. Under our legislation in the UK, we didn't have a health focal point to deliver some of this, and we really needed to look at how we do it. So in 2011, we set up an extreme events team, and to my delight, it continues and is now being led by other colleagues. So extreme events, everything from flooding to thunderstorms, but the impacts are the ones that frighten us. Cars, hopefully without people in them. Cleaning up afterwards. What a nightmare. I don't know if any of you have been flooded, but the pain of cleaning up wrecked materials is really shocking. And this is a photograph from the UK. But this one was a photograph that I personally took. This is in Sheffield, where we had a massive flood. And it was a flood immediately outside our public health offices in Sheffield. So you don't only see the floods, but behind it, we had a really difficult chemical fire that the fire engines found it really awkward to get to try and manage. So it's the complex and cascading hazards that can be really difficult to deal with. And I've had the great privilege of working with the WHO Regional Office for Europe and my role in Public Health England, as we were then, to review the health effects and prevention in the WHO European region. This is the report, and I do commend you to look at it. And I had the great delight in working with my good friend Bettina Mene. We edited this really amazingly important report, pulling together all these health effects and how we might prevent them. So what are the health impacts of flooding? Well, we know the direct health impacts. If I ask you, you would pick up drowning. You would probably talk about physical trauma. You might not think about water shortages because that's actually a huge problem in flooding. And did you know we get chemical contamination of floodwater? And people who are in the midst of it can have heart attacks. They can be electrocuted. Thailand had a terrible problem with some floods in 2011, and they had people who were electrocuted and died. And it's happened again recently. And as you can see, you can get fire. But we also have infectious diseases from contaminated floodwater, which may be with vector-borne or even rodent-borne diseases. But there are indirect effects, which may be harder to think about. So one of the things that we've found really important has been carbon monoxide poisoning. And this comes from petrol and diesel generators and other similar fuel-driven equipment that is used indoors, which is not safe. They should be used always outdoors, as you know. And then the impact on mental health. I'll talk to you further about that because I think it's really worrying. And then you have illnesses associated with disruption of reduced access to healthcare. And of course, the disruption of livelihoods and income, something that is really shocking. And who is vulnerable? Well, we know children, pregnant women, those with physical impairments, those with sensory impairments who can't receive the messages, or with cognitive impairments can't necessarily understand what the messages and early warning might be. The elderly have been particularly vulnerable in Japan, for instance, recently, but those with chronic diseases may not be able to get out so easily. But we also know that the homeless are vulnerable. Those with cultural and language-based vulnerabilities, with weak social networks vulnerable, those who don't know about public warnings and guidance, and in the high-risk built environment. And of course, we so often forget tourists. And tourists are not necessarily tuned in to what we need to do. So there are other indirect health effects. Population displacement, disruption of water, power and food supplies, damage to infrastructure, including healthcare facilities. You might have to go and get bowsered water because we can't get water to you very easily. It's not clean. Or when we reviewed the 2007 floods, we had massive flooding of our electricity substations. And of course, we couldn't use those, so people had no power. So we know things can be really complicated with flooding, and we thought that would be important to share with you. So one of the things we did when I was leading on the extreme events team was that we did some advice and guidance to the public. So we did it both from the health side and from the environment side. And we felt this was really important, and we shared this to get people to think about what they might need to do for flooding. So the first thing is to think about it before and understanding what the warning messages are. Think about a flood plan. Prepare your home in case of a flood. Know where your air brake covers are, or possibly even your backflow valves. Buy flood insurance if you can, but I've just been looking at some reports from flooding in some of the Pacific countries, Pacific island countries, and they can't afford it. So very difficult. And then you need to think about listening for floods and what you need to take in a flood kit. So we need phone numbers, insurance documents, bank cards, money. But one of the things people often forget are the medicines and medical devices that people need. Clothing, toothbrushes, and personal items, those are easier to replace as our baby equipment. But you also need to think about turning off your gas, your electricity, your water, so things don't rack up when you leave your home. And just be really careful not to hurt yourself. And of course, we know that during the flood, accidents happen in floodwater, and that you need to move your family and pets, and you mustn't touch electricity. And remember, flooding is stressful. And most importantly, you must wash your hands in clean water because of the risk of foodborne diseases and waterborne diseases. And after a flood, wow, that's tough. Take care when you go into the floodwater. There could be lots of hidden dangers. And you need to be careful, as I've said already, with diesel generators, and do not turn on any of the equipment while it's wet. If you're feeling tired and anxious, having difficulty sleeping, not surprising, look at the water quality. Cleaning up after a flood, how do you do it? How do you manage the rubbish? And finally, how are you going to pull all this together? For a lot of people, this is really difficult. So one of the things that I wanted to share with you is how we're doing this at a global level. To me, flooding is something that is critical across the world. So in 2015, we had the incredible UN landmark agreements of the Paris Agreement, the Sustainable Development Goals, but also of the Sendai Framework for Disaster Risk Reduction, which followed the Yokohama Agreement and the Hyogo Framework for Action. And it was so important we should deliver this. I had the great privilege of being the vice chair of the Science and Technical Advisory Group to support UNISDR to deliver the Sendai Framework, and got much involved in trying to respond to UN member states' inquiries and discussion points. What we had at the end of it in 2015 was the most amazing agreement on a global outcome, 13 guiding principles, 4 priorities of action, including understanding the risk, governance, investing, and how to build back better, as well as these incredible 7 global targets and 38 indicators. So the targets that matter: reducing mortality, reducing the number affected, reducing the economic loss, reducing the damage to critical infrastructures, particularly health and education, but also increasing each country's awareness of their risks, and to build international cooperation and to improve the availability of early warning for all. But from the health side, we had these really strong messages. So the Sendai Framework is really important for everybody who's responding to extreme events and disasters, and who is aware that climate change is a driver of these. So we need a resilience of a national health system. We need the capacity in health workers. So this course is just a brilliant example of how we're trying to build that. And we need to promote the training capacities much more widely in disaster medicine, but implement the international health regulations. I'm sure somebody will have talked about them, but I thought it would be useful to add a slide. The WHO international health regulations have been sharpened and really engaged, and they are there to provide an overarching legal framework that defines countries' rights and obligations in handling public health events and emergencies. And it is an international law that is legally binding in 196 countries, including the 194 WHO member states. It grew out of the response of deadly epidemics that once overran Europe. And the regulations are there to really help us to understand a public health emergency of international concern. And all of you, I'm sad to say, will remember COVID. But part of this is something that we include in implementing health emergency and disaster risk management. There's a wonderful website you might want to go and have a look at from WHO, where we have many frameworks, many different processes, methods, ideas about how we can do a lot of this work. But I really wanted to introduce you to one that I believe is truly important, which is the WHO Health Emergency and Disaster Risk Management Framework, which takes all these other frameworks, which I've just shown you, pulls them together into this umbrella, this chapeau of really how to get international health regulations linking to the Sendai framework to deliver something that really engages all. So let me talk you through it a tiny bit. It aligns global health security, disaster risk reduction, humanitarian reform, climate change, and the sustainable development agenda. And it bridges health and the multi-sectoral communities because all of us need to be involved. And it's derived from things that we've been working on in many ways, but it hasn't been brought together until this lovely framework that was published in August 2019. It has a great Annex 2, which is really lists things that we have to do. So it talks about policies, strategies, and legislations, which are different in every country, except for the international health regulations. But it's really important that you're aware of those and can use them. And that we plan and can coordinate at all levels and have the human resources who know what to do, which is absolutely vital. And to do that, we need some financial resources. But we also need information and knowledge management. How can we manage this better? How can we use our knowledge about flooding and waterborne diseases to really try and improve and limit the impacts? So we need really good risk communications. We need health infrastructure and logistics, and we need things to work, even during emergencies, both before, during, and after, to deal with these surges. And we need community capacities for health, emergency, and disaster risk management. And these need to be monitored and evaluated so we know what we need to do that would be better. So in your work in the future, do think about this because it's a really useful framework. And behind this, we have built something that we're really proud of, which is the WHO guidance on research methods for health and disaster risk management. Do look at this as you're being trained on this course. It is something that we wrote for you and for everybody who is involved in disaster risk management. It has an introduction. It tries to get you to identify and understand the problem. It helps you to determine the scope of your study. How can we make it better for you? Shares with you guidance on study design. Takes you to special topics to demonstrate research processes and benefits and addresses emergency research needs. And then it has a really useful ending of how to become a researcher. If you ever get stuck, do let us know. But we're really keen that you should use this. And we know that the current version has all the materials and chapters, webinars, chapter videos, and podcasts. Do have a look at it. And we will be launching an updated edition, possibly by the end of this year or early next. And I really commend it to you. So we know that health has got a really critical role in working across everybody, and how we can do this. But part of that is also important that we know how to measure whether we make any impact. And as part of the Sendai framework, we now have the Sendai framework monitor system. And that is live, and everybody, each UN member state is there to report twice a year. But when we did the reporting in 2018, we found that the UN member states really struggled about what was the technical and scientific capacity to assess disaster risk, vulnerabilities, and exposure to all hazards, to every hazard, really critical. So I had the great privilege of being asked to chair this, to be able to lead on this. And I worked with about 40 different wonderful UN agencies and organizations who were just amazing, with a huge number of the International Science Council partners, the Global Voice for Science. So we had all sorts of people on integrated research to the Global Earthquake Model Group. And of course, our insurance partners who know about insurance development and reinsurance, but we can't do it without communities. So we have the International Humanitarian Organization and the International Federation of the Red Cross, Red Crescent working with us. So there were many, many, many involved. Then we had the volunteers. And then we had lots of people who reached out to us and back again. So we had the most incredible engagement, and we agreed how we would build all this together to know that the hazard has the potential to impact on our community, proactive and reactive measures are available, and the hazard has spatial information and temporal components that could be really useful. And I was delighted to say that it was agreed by the UN that the Sendai Framework, the Sustainable Development Goals, and the Paris Agreements all work to deliver using these common set of hazard definitions for monitoring and reviewing implementation. So we did an amazing job, which we hope will help you. And when the midterm review of the UN framework, the Sendai framework, came through, I was so delighted that they described it as groundbreaking, because the work that went into it with so many was just staggering. And I'm so proud of it. And it's online, and it works for early warning, and it links to disaster loss and damage tracking, and it is a standard, as you can see here with the other standards. And then in 2023, I was asked to plan for, as chair again, the update for 2025. So we did a user survey, which was absolutely tremendous, and the feedback was amazing. Valuable resources to contribute to effective DRR, as helping with aiding risk assessment, preparedness planning, and resource allocation, enhancing community awareness, supporting policy formulation, and serving as crucial tools for informed decision-making, play a vital role in the work of the person who I will share with you at the end, guiding policymakers, assisting emergency responders, and engaging communities. They contribute to monitoring and evaluating the effectiveness of this at a local, national, and international level. And this was somebody I didn't know who responded to our survey, who came from a national disaster management office in one of the Pacific Islands. And I thank them for giving us this feedback of positivity, which really encouraged us all to know that we could update the hazard information profiles. So we've prepared these, and we had the global launch in August this year, so very recently. So really up to date, and let me just show you a little more about it, because you can download them from this QR code if that would be helpful. We now have 281 hazards. And of course, in the hydro and meteorological hazards, we have flooding. But we have convective issues, particle issues, wind and pressure, precipitation, flooding, temperature, water-related flooding, marine-related, sometimes flooding, and terrestrial hazards. But we've got space weather, we've got chemicals, we've got infectious diseases, we've got technological, looking at cyber hazards through to waste, to transport accidents, and obviously construction failure. Environmental hazards, about environmental degradation, to geological hazards, and for completeness, we were allowed to include societal hazards, including conflict and post-conflict events, behavioral, such as social unrest, such as civil unrest, and obviously violence and other issues of real note, like stampedes, as well as economic impacts. So, sorry, something's gone wrong with my slides. I'm going the wrong way, that's a good idea. Right, let me take you through the flooding one. This is the hazard information profile on flooding. So it's really clear, it's very much there for you to use. And the whole purpose of it is that you'll notice here we have the health impacts of floods, but also the economic impacts of floods, which might be useful. And then we have the multi-hazard context, and we have measures on risk management. And it's literally 4.5 pages with open access references. So let me show you the how we've done the multi-hazard context. So this is the driver of floods. So you can get geological hazards, you obviously get hydrometeorological, thunderstorms, cyclones, rain, but you get technological, dam failure and reservoir failure. Then you get flooding. And then you have the geological hazards, which are so key. That's a consequence of flooding. You can get soil erosion, and you can get soil degradation. And you can also get all the technological hazards of buildings impacts, drain and sewer flooding, land transportation accidents, problems with landfilling and all sorts of things. You can get environmental hazards with runoff, and you can even get, in societal hazards, explosive ordnance that floats and makes it much more vulnerable. But if you look at the biological hazards, which I know you're particularly interested in, you get diarrheal diseases, waterborne diseases, cholera, locusts, fungal plant disease, human-wildlife conflict, and indeed the risk of snakebite envenomation. So really important to think through these things when we're planning for it. So other hazards include space debris, earthquake, loss of mangroves, corrosive substances, foodborne diseases, building collapse, and environmental degradation from conflict. This is the waterborne diseases, so you can see if that would be of help to you. This is the diarrheal diseases. This is leptospirosis, cholera, cryptosporidium, paratyphoid, typhoid, foodborne diseases, levels of contaminant in food and feed. And these were some of the things that I know that I was asked to address in this talk, just in case, to make you have access to these resources if this would be helpful. It's all online now, it's all available. And to me, what is really important, it's only happened because of the incredible and effective collaboration between experts from different organizations, agencies, and disciplines. And it's been absolutely essential to have this incredible network of colleagues who worked with us to deliver this. But we also wanted to make it scientifically robust, but also user-friendly. Is it going to help you do what you need to do? And it actually explains to you some of the issues that you're concerned about. So feedback is always welcome to me. And as part of the work we are still doing, we're working with the United Nations Office for Disaster Risk Reduction and the International Science Council on a machine actionability working group to develop the means by which we can encode the terminologies in line with the FAIR principles: findable, accessible, interoperable, reusable. These principles that are so key, but also to make translations easier, to get it into local languages and facilitate AI usage. So we hope we can teach AI to be able to use this more easily in any language that's going to help you to deliver what you need. And we could only do this because of the incredible engagement of many. Our steering group, our technological groups, our user, multi-hazard, machine actionability groups, the contributors, and indeed the reviewers. We've had the most massive exercise to deliver this. And I thank everyone, including my wonderful colleague, Hélène Jacob-Descombe from the International Science Council, who has been our project manager. We launched this at the global platform, and we thought it'd be really useful to share. And then we had a really formal launch in August, where we had very senior people working with us. So let me go back to flooding. Let me go back to what happened in December 2013 to February 2014. I think you'll agree that the United Kingdom looks pretty damp and wet. You can see that we had a huge amount of rain, way above the average for most winters. It was a really bad winter, and we got into a lot of concern and trouble. And one of the things that I thought I should share with you is the English National Cohort Study of Flooding and Health. It's a cross-sectional analysis of mental health outcomes at year 1, and it was repeated at year 3. And it was done by my great colleague, Tom Waite, who is now our Deputy Chief Medical Officer for England, and I work with him still pretty closely. And it was just a huge piece of work, and you can see many of my friends who did this. What it was to have a cross-sectional study analysis of neighbourhoods flooded between December 2013 and 31st of March 2014. Validated instruments to screen probable psychological morbidity, and then prevalence and odds ratios were calculated. So I'm going to show you as simply as I can some of these results. What we did was to divide those into those who were really flooded, those who were disrupted, and those who were not flooded. I think you'll find it pretty shocking to see what happened to the flooded, those that were disrupted, and even those who were not flooded. The impact on the flooded really showed that more than 70% had either probable depression, probable anxiety, or probable post-traumatic stress disorder as a result of being flooded. Even those disrupted, there was over 30% who had impacts of similar nature because they were worried too. And those who were not flooded were still pretty distressed. So we know that adding flooding to anxiety that's already present in a community can result in very difficult problems indeed. So let's turn to tropical storm Debbie. This was a cyclone that came in 2017 to Australia. And the reason why I'm really showing you is that we used exactly the same system to respond to this flooding in Lismore, where I was asked to go and visit, and we discussed what they could do, and we shared with them the results that we had done before, and we shared with them exactly how we had done our assessments, because they thought this would be very helpful to manage it. Unfortunately, Lismore has been flooded since again, and from 2017, Australia's had quite a few of these very bad weather events. But let's just think about how we might look at this for prevention, for preparedness, response, and recovery. You can see in prevention, we looked at structural solutions, nature-based solutions, and reducing greenhouse gas emissions. Wouldn't that be nice? But for preparedness, we're looking at public awareness, which I've shared with you, effective warning systems, and also the preparedness of the healthcare systems. Everybody working in healthcare needs to be ready, needs to know what they can do and how they can do it. And then in the response, I've already talked to you about the need for basic hygiene and sanitation, treating injuries and illness, and preventing and controlling infectious diseases. So vaccine programs, surveillance programs, and early detection and contact tracing. But also addressing long-term health and social needs. So ensuring effective management of chronic disease, special focus on mental health, telemedicine, and financial support for immediate relief. This is a paper we published in the New England Journal in November 2024, and you might find it a useful paper to go and have a look at because there's lots of useful material in there. But I thought then I would take you to something that's also been recently published about hurricane exposure and the risk of long-term cardiovascular disease outcomes. And this rather shows that after Hurricane Sandy and the flood impact that it had in 2012, that there was a continuing and worrying impacts from the cardiovascular disease outcomes. Do have a look at that paper too. Now, there's no other way for us to think about it, I don't believe, except to look at WHO's excellent description of El Nino. On one hand, you get droughts and wildfires. On the other hand, you get floods and cyclones. And you can see the different types of direct injuries and fatalities of vector-borne diseases, waterborne diseases, or disruption of health services and mental health impacts on the left-hand side. But on the right-hand side, you get malnutrition, communicable disease, waterborne disease, reduced access to healthcare, and respiratory distress and heat stress. So I just wanted to share this with you as a quick way of looking what we mean by El Nino, the impacts. And of course, in WHO terms, there's been a huge amount of work going on climate change. I'm sure you're aware of the vulnerability factors, the exposure pathways, and the health system resilience, along with the health outcomes that we need to think about. But what we do know is health emergencies from climate change and variability are complex, as health impacts are often compounding, cascading, and interacting, as I've shown you from our hazard information profiles. And if you look at the Intergovernmental Panel Climate Change Assessment Report 6, you have this image where we know people born in 1950 probably knew a normal spring, summer, autumn, winter. But maybe those born in 2020, and if we have really significant warming, which the world looks as if we may have, they really won't know a clear spring, summer, autumn, and winter in the future. We have a lot of things to think about. But what we do have is an amazing UN Secretary General. So Antonio Guterres has talked about extreme heat, having extreme impact on people and planets, and the world must rise to the challenge of rising temperatures. And he did an incredible press conference in July 2024, really trying to get people to think about workers and jobs and employment and heat and health and what is sustainable cooling. He was just tremendous, and we got this report on the call to action on extreme heat, which I show you here, and I show you the first page on the science of it. But what I delight in is that the definition that is used is the one from our hazard information profiles. So what we've done is to share evidence in a way that we can follow throughout the world. So we know that the extreme impacts from heat include many deaths, a reduced amount of food, the problems with expensive installing cooling capacities, that millions of hours are lost by workers, and that there's a real chance of increasing poverty for every 1 degree C, and that 80 million students are impacted by worldwide school closures due to heat as recently as 2024. And on top of COVID, this really makes it very difficult. But the images about heat are truly frightening. So I've had the privilege of working with colleagues who've been at the United Nations COPs, the Conference of the Parties. This is Conference of the Party 27, which happened in Sharm el-Sheikh in Egypt. And we worked on building the 10 new insights in climate science with Future Earth, the Earth League, and the World Climate Research Programme. What we showed in one of the 10 issues was number 3, which is new threats on the horizon for climate, heat, health interactions, and the impact of climate change on the health of humans, animals, and entire ecosystems are increasingly widespread, and new risks are emerging. So what we did was to have this amazing diagram where we show that climate change has urgent policy needs at the top for surveillance and early warning system and multi-sectoral information sharing for extreme heat, wildfires, and floods, loss of biodiversity, and infectious diseases. And the consequence of this might be increased use of pesticides, increase in antimicrobial use, decline in ecosystem function, decline in food production, increase in pathogens spillover, and change in the rate of vectors and pathogens. And the impact will be on mental, physical, and mortality. And it will include humans, domestic animals, wild animals, and plants. So we have urgent needs for mitigation, adaptation, increasing resilience, and climate change attribution studies. So let me just finish by sharing with you some of the things that we've been talking about. I've shared with you the Health Emergency and Disaster Risk Management Framework. I've shared with you the guidance on disaster risk management. I've shared with you the updated hazard information profiles. I've shown you that there are 281 hazards that all interrelate wherever we can. And we hope this will be useful to you. And of course, flooding causes many other hazards and is driven by many. And we know that we need early warning for all in a way that will get to people, because even when we were doing this in 2013-14, we found it very difficult to share the right bits of information. But we know that the UN landmark agreements of 2015, the Sendai Framework, the Sustainable Development Goals, and the Paris Agreement are absolutely critical. Thank you for letting me do this remotely. I'm really sorry not to be with you online, but I have to go and work elsewhere, and I'm not available in person. But please let the team know, Dorothy and the others, if I can help provide any further information. And you will have many resources shared with you if these would be of help. Enjoy the course, and I hope this has been a useful contribution. Thank you.
Wow, thank you so much to Dr. Virginia Murray for her excellent presentation and sharing all of those really wonderful resources with us. I hope that everybody will find them useful in your teaching. Now we want to move on to our first case study, which is from Dr. Ann Dorothy Slovic. Dr. Slovic, please go ahead.
Great, thank you, Dorothy. I'm going to share my screen with you. Give me a second. Can you all see it? All good?
Yes.
Okay, great. Well, first of all, it's really an immense pleasure to be here with all of you. It's amazing to see the messages in the chat and see how we have people from all across the globe and here interacting. And thank you, Columbia University, for facilitation. And it's also like a challenge and a privilege to talk after Virginia, and her presentation was extremely insightful, very informative. And I would like to say, and I hope you're sharing my opinion, that she provided us with a lot of great resources to actually bring all this information to our classrooms and also to our research and publications. So this say today, I am here representing the Global Health and Sustainability Program in the School of Public Health. And I'm going to talk to you about the climate hazards in Latin American cities and barriers to adaptation and actions. Oh, sorry. Let me just go back here because I can't forward. 1 second. Sorry about that. I just wanted to spare a few seconds and a few minutes of my presentation talking to you about the Global Health and Sustainability Program. I strongly believe that one of objectives when we're presenting in this climate change classroom is also to talk to you what are the different tools and what are we doing at the local level to address these issues. At the School of Public Health, located in São Paulo, from the University of São Paulo, as I say, we have this program that was actually founded in 2013. It was the first global health program and is addressed only doctoral students. We have, this main goal to train researchers and professionals to address complex issues related to climate emergency, but also like health issues that go across borders. Virginia gave us a very global perspective. She also brought to us some great examples of floods in England, in the UK. Let me try to bring it back to the global South reality. Like if it was devastating in the UK, imagine in places where we don't have all this money, we have all this data. And so this is very important to think that creating a program such as this one is actually extremely important, because we need at the local level to train people. We need to help them to have the tools to build this data, to have the tools to engage, to have the tools to absorb things like all the information Virginia just shared with us, okay? That brings me to talking about the program philosophy and goals. You know, we want to challenge Northern-centric research agendas. We want to make something that corresponds more to what are our needs, what are our challenges and regional challenges. I know we are going and we're facing transition times right now, but at the program, we strongly believe in the international corporations, and we strongly believe in promoting this global South perspective, prioritizing people and environments. This said, oh, having again my little issue here. The program has two main approaches, right? We look at international policy systems and institutions. Here, our main objective is to look at globalization impacts on health, environment, and policies institutions. I'm going to spare you all the details of the focus areas. You're welcome to go and look at it. But I'm putting that because I want you to understand that when we're also addressing climate change, we're also looking at all these different lenses when we're doing our doctorate and research program in the School of Public Health. And this is the beauty of the program, is that we have all this diversity of topics that we are looking at when we're doing a research, right? And of course, whenever we're looking at all these issues, we never forget the sustainability and lifestyles. It's exactly what I was telling you right now. We're talking about how people live. We all here can agree the importance of the social determinants of health in everything we're doing. But I think we're going also here in one more step. We're really very strong into thinking about the decolonization of global health. And I'm not trying here to be just political. I'm just trying to really bring to you the attention and awareness of this interaction between global and local. We keep talking about that. I'm not telling you anything new. This is something we all know, and this is something that I strongly believe should be in the classroom. So we have here, different topics, but I would say that climate change touches all of them. But now back to our topic today, and my apologies for spending like a few minutes talking about the program, but I thought it was essential to bring this awareness of what we're doing and how we are organizing it in our classrooms. And I would like today to share with you a work that I have written with some of my colleagues at the Solar Bar projects, led by Drexel University in Philadelphia. So that was an amazing partnership and an initiative. For those that do not know, Solar Bar, which means urban health in Latin America. It was led by Dr. Ana Diaz-Ru. And I'm also want to explain that because this program was really important in terms of building data and resources for us researchers to do quality and robust research, as Virginia was saying, but also, to strengthen links between the region, to interact more with our colleagues. As a matter of fact, if you look at the Lancet Countdown, now is regional, and this is really great news for us because it's a way to get more exposure, it's a way for working together and finding solutions in a context that is similar. So here I'm going to present, making the links about all that, a study that I did on climate hazards in Latin American cities with my colleague, and how we try to look at understanding the role of the social and built environments and the barriers to adaptation action. Let me just make a parenthesis here. When we think about Brazil, so we have 26 state capitals, including the main capital, and we only have about 15. I bet that most of you here, or share fair of people that are here attending, can relate to that. Okay, we have all this data, but if we don't even have an adaptation plan, what happens? But anyways, here, the core of the problem, so climate change, increasing the frequency of extreme events, threatening the health and well-being of urban population. The Latin America is an interesting example. Of course, unfortunately, the strong disparities that we have. Also like the fast-paced urbanization. That's the importance also looking at urban context in the region, and all this context vulnerability to climate hazards. I'm not going to go through that. Virginia did a great job explaining all this vulnerability. So here, our objective was to characterize reported climate hazard adaptations, action, and these barriers. And we looked at 124 Latin American cities, and we look at the city association between the social and the built environment. To do so, we work with the CDP survey. CDP is the former Carbon Disclosure Project, right? And we look at the 2019 survey. This nonprofit organization, it's a global organization, they have a survey that is sent to public officers in city. So, okay, we are looking at the class. What are the public officers doing with what we are able to produce, Not only the public officers that we're able to train in our program, as I was telling you and I was trying to pass to you through our global health program, but how do they understand, because it's by understanding that's also their perception that's also going to help them planning, intervention, action, adaptation plans, right? So here you have, the sample of the cities that you can see the different dots by population size. We did a whole cleaning of our data, matching our data for the cities that we had, and also the surveys and the cities that are surveys from CDP. And we look at the frequency of reported hazard actions and challenges. We run some check-words tests, and we were able to look at city characteristics such as density, population, GDP, greenness, education level, and urban fragmentation. And just a big, overview, bringing back to our topic today. So we saw that the city studies reported a median of 3 climate hazards, and this goes along some of the reports here we have globally that actually have also this average of 3 climate hazards reported mostly. And as the top hazards, we have storms, water shortages, landslides, floods, and biohazards. And the reason I'm bringing all these to you, understanding that the topic here is particularly floods, because I also see all these hazards contributing to waterborne disease. So I just wanted to point out, and you can see here the distribution and the frequency, and so the darker it is, the more likely were the public officers that answer to the survey to report the and apologies for these big tables here, but what I want to stress out is that all these hazards, floods, storms, water scarcity even lead to long-term impacts on human health. And as we have the direct impact, but after flood, we have an increased range of transmissions of infectious disease. And this really challenges public officers. This challenges our system, push pressure on our health system. And of course, most of all, it endangers populations that are living in the most vulnerable places. So here is just to briefly show you how we did, with the frequency of reported hazard. And also when we look at the reported adaptation, action, and enchantment. So first we look, how often, do you encounter that? Which one do you encounter? And these all come from the survey, okay? And we also then look, okay, so what kind of adaptation actions are you taking? Okay, then, and what kind of challenges we're taking? And then we cross and we look at this data to see what are the characteristics that we can see in terms of the social and built environments. So looking at flood, flood, our topic for the day, we understand that, we had to merge categories. So we look at flood, like including a river flood, surface flood, coastal flood, groundwater flood, and permanent inundation. So we saw that specific flood reported by city, surface flood reported 35 times, where it's reported 35 times, so 28% of the cities reported it. River flood was 23% of the city, and coastal flood 12% of the cities. So it was extremely significant, 30% of the total of the 124 Latin American cities, so they reported it. In terms of geographic distribution, Colombia was the winner on this one. It's of course, it's more likely that cities that are near rivers or by coastal coasts would be reporting it more. But in Colombia, it was a little bit different because even in remote place from the oceans, we have public agents reporting floods as well. Now let's focus on the waterborne disease as climate hazard. Here we combine vector-borne disease, airborne disease, and insect infestations. And it could be, I was even thinking about the general presentation and how the terminology and how you group things, but this is how we designed, this is how we decided to group it. And we saw that biohazard, for instance, was reported in 27% of all the cities. Especially waterborne disease was reported by 13 cities in the sample, representing 10% of the total number of city surveys. And here, Brazil was the big winner in terms of this report, with 7 cities reporting it. Again, remember, this is a sample that comes from 124 cities across the Latin American region. Now let's go back to the city characteristics and reported risk plots, right? We saw that when we're looking at city size and density, floods were statistically associated with the city size and density. So the denser the city, small cities, or were less likely to report floods compared to medium and large cities. And when you think about the current realities, it's very common in Latin America, and particularly I can talk about Brazil, that you're going to have informal settlements in regions that are really prone to floods. Here in the city of São Paulo, one of the mega cities of the world, we have a lot of settlements by a completely polluted river that public officers have been promoting to clean for decades now. That's constantly, Jardim Pantanal, it's called, is constantly flooded. So it's almost like likely that if you live in in a smaller density, you have less reported of these floods, right? Because perhaps you have a more control of this urban sprawl. And again, in Latin America, we suffer from the lack of urban planning. Most of the cities were just constructed as we go, and with no urban planning. So it's kind of almost normal to have this normal. I don't say if it's normal is the right word, but it's not surprising, I would say, to have this feedback, right, as related when we're thinking about the city characteristics and floods. So looking at biohazards, storms and water scarcity, we saw that small cities were significantly less likely to report biohazards compared to the large ones. We also saw that the question of the density was also a key factor, and that's also goes in logic for me, but when we look at also at extreme temperatures, at landslides of floods, at the impact when you have density. I don't know how many of you have heard about the big flooding that we have in Porto Alegre, the city located in the south of Brazil last year. It was terrible to see the pictures that we saw, the impact, and not just on human life. I have a very One Health approach to the problem, but animals and all the devastating. So what we saw also, it's a lot of participation of civil societies to help in engaging and in helping people that were victim of this. Also, the urban fragmentation that we understand here as an uncontrolled fragmented cities were more likely to report storms. Scarcity, we have it in less likely. In more fragmented city, we're less likely to report water scarcity. We can think here about a better water management, or at least more people specialize to be able to deal with water issues. We also, we talk a lot about greenness, nature-based solutions when we're talking about climate change, when we talk addressing all these issues. But we saw that, for instance, water scarcity and greener cities were significantly less likely to report water scarcity. So like here an association and the importance again that we have to focus on green initiatives in the cities. So this is just a really brief overview, just to show you that we wanted to bring these issues to stress out that when we're looking at such an issue, as floods and waterborne disease or other diseases, climate diseases, climate sensitive diseases, it's very important to look at all this framework. It's important to bring to the classroom, to pass it to our students also. We can't look just at the health issue. We can't just look at the disease. We have to look at all this context, right? So overall, cities report an average of almost 2 adaptation actions. When you think about it, it's low. And 23% of cities reported no actions at all. No actions at all. And most of Latin American cities, and I'm talking about the major ones, they're really like struggling in developing these adaptation action plans. So we need to like think about the classroom, but go beyond the classroom. How do we develop this course that interact also with all that, right? Flood management, for instance, was reported by only 10% of the cities, but I just told you that it was one of the major problems, right? So we have action that included development and operation of flood defenses and flood mapping. Water management was reported in 30% of the cities. That included storm water capture system, promoting water efficiencies, and diversifying the water supplies. And surprisingly, and we all hear the importance of interdisciplinarity, the importance of working together, health, environment, on those different departments. But what we saw from the data we had is that public health related actions, well, were only reported by only 50, 70% of the cities. It was almost nothing. So going back as offer in Latin American cities from that. It's hard to do the urban planning, and I'm sure that my colleagues in the global south across the world and here present in the Zoom link can share that with me. It's hard. It makes everything difficult for us as researchers, but also, for the public officers that are there dealing with all these climate emergencies. So this go back to land use planning, infrastructure, condition, maintenance, infrastructure capacity. Living condition is a big one, right? We're talking about, again, one of the most region with the highest disparities, and that means poverty, that means poor housing. So all this socioeconomic inequality, this spatial segregation, waterborne disease more prone to these hazards, right? And finally, one of the biggest challenges, because it's very often comes down to money, and we have to be very honest about it. It comes down to money for research. It comes down to money to be able to have the financial resources at our disposal to be able to react, right? Talking a little bit more about the least frequent reported, as I was just saying, overall, so I'll give you an example of like more challenge for specific hazard, but here overall, only 2% of the challenge, public health was a challenge reported. But we just keep talking about all the health issues. How come? How come in the head of the public officer, the designing an adaptation plan, only 2% of the cities reported public health? And of course, that's always an issue, access to quality and relevant data. And also, like, if we're doing hazard mapping as a common adaptation action, and if we don't have the data, it's hard to do a good hazard mapping, right? And this generated a sort of like indirect consequences, as we were saying, things like migrations, right? Forced migration, the environmental migrant it's real, it happens. And this generates a sort of like safety and security question that are only reported by 2% of the cities, but is very likely to increase over the next decades. Now, I just wanted to conclude, and I know that I probably went a little bit over time, I apologize for that, but I wanted to bring back these results from this case that I just brought to you. First of all, I just want to reiterate that I believe that case studies are a very important tool use and importance of case studies, and also to challenge how if they are replicable or not, right? But in any case, we still hear that in terms of public health implication, we know that climate hazards are recognized as posing a significant risk to human health, but you know, and thinking also about the transmission of vector-borne disease, we saw also that there is, we've been seeing in the course that there is in the region increasing mortality risk due to extreme temperatures, right? We also seen from this specific study that the adaptation responses are limited, and also the problem of health-related challenge often unrecognized by city officials. And I just wanted to point out also that research suggests that hazard reporting in Latin America have negatively impacted health, increasing the spread of infectious disease and mortality. And I can only stress again the lack of public health awareness of the people that responded to the city, and understand that this is reported and it's just a sample, but it's pretty representative of what's happening right now with us. Now, bring back of how we can integrate research findings in the classroom. You know, again, we need to emphasize the interdisciplinarity between the urban environment, the social vulnerability, and also health. I'd like to add here, like, bring awareness to our students when they come with a project, when they come with an idea. Look at the city characteristics, look at inequality, look at density and greenness, and you know, and see how they're associated to the reporting specific hazard you're studying, or the emergency of climate change, right? And you know, and that's why again I believe that using case studies is a great way to illustrate and recognize the climate risk. But also I want to go a step forward and say that research cannot just stay in a publication. Research cannot just stay in the classroom. We have to engage as you know, as teacher professors. We also have this role to go and continue this dialogue with public officers, so we can see our data, our research transform in sustainable and inclusive policy. So for today, that's what I wanted to share with you. And I thank you again for the opportunity to share my work with all of you. And here you have my email. I'm available also in the chat if you have additional questions. Thank you so much.
Thank you so much, Dr. Slovic. That was a really great case study, bringing it down to the local level, and really also highlighting how case studies can be used in teaching. So really appreciate that. And now we'll move on to our second case study, which is from Dr. Marija Shevchuk. Dr. Shevchuk, please go ahead.
Thank you very much. Just to start, you can see slides. Thank you very much. I'm really happy to be here today with all of you from the globe. This is the most extensive course that I engaged in, and today I will talk from the perspective of water as resource, as important resource for our life, and as a risk at the same time because of climate change, because of human activity. And I will talk from the angle of my experience, personal experience, and case study Serbia. I'm coming from Serbia, from University of Novi Sad, Faculty of Medicine. Also, I'm public health expert, and I have a lot of experience in some disaster and extreme situation, not only in floods, but also in other. Today, this is topic, the water as a resource, but also as a risk. Water is really indeed an essential resource for our life and for human survival, for animal, for One Health concept, agriculture, ecosystems, climate regulation, industry, etc. But it's also a big risk. We can see that our planet it's now it's sick, have a disease because of climate change, has higher temperature, and that we have planet which is provoked and now unwell, responding with grave symptoms like flooding, heat, and drought. And we can see that 30% of European river network exceeded high flood threshold during the year, last year in 2024, and more than 10% exceeded the severe flood thresholds. And we also have experience in Europe with Spain in Valencia. This is really very extremely difficult situation. Serbia was confronted with the worst flood disaster in the past 120 years in 2014. And I would like to share with you the video without any speaker, just you can see the situation in Serbia during the 2014, and this is the main issue of our case study. Please see it. So we can see a loss of life and injury, but also property damage, economic impacts, displacement of communities, environment consequences, infrastructure damage, health risks, social and psychosocial impact, climate change amplification, challenges in emergency response and in public health network of healthcare organization, and other risks. So summary of estimated damages and losses can divide in social, productive infrastructure and cross-cutting issues like housing, education, health, culture, agriculture, manufacturing, trade, tourism, mining and energy, transport, communication, water and sanitation, environment and governance. And also it's very important that we had an opportunity to include post-disaster needs assessment for recovery and reconstruction. I was personally experienced in healthcare issue and assessment of healthcare organization and their post-disaster needs assessment and recovery. And this is a very important issue to increase awareness, after all, for better preparedness before floods and before extreme situation. And you can see here in the map almost one big territory in Serbia, which is influenced and experienced flood in a community, and we need help outside of our communities, our country, but also help of NGO like Red Cross, for example. And estimation of disaster effects, we can see sectorial distribution of damages and losses, and we can see that mining and energy were extremely high, not only in damage, but also in losses, and assessment of disaster effects in infrastructure and physical assets was very high. Also, emergency response team was active 24 hours a day. We are all active from different kind of specialization during the floods, together with Ministry of Health and Red Cross. And then after that, we include post-disaster needs assessment, coordination of activities, and collecting, analyzing, and reporting data was enormous in drinking water quality, water supply situation, epidemiological situation, with electronic reporting within established alert systems and risk assessment. And we cooperated with the veterinary colleagues from veterinary sector because of zoonosis and risk of zoonosis, and also we established surveillance and of collective centers, sanitary hygienic conditions, the number of displaced people, medicines, and healing displaced people. And also it was very important to give them psychosocial support during this evacuation and migration, with very diverse spectrum of population, from children to very age and very specific disease. And also this picture is for me important because we can confront with acute and chronic mental health consequences because of flooding and damage regarding homes. And this is very often pictured during that period of time. And when we talk about healthcare organizations, we have 7 hospitals, 10 health centers, more than 30 health posts, and some pharmacies, health-related facilities, a lot of equipments, furniture, which is damaged, with a lot of money, and cost or estimation of losses in the health sector. Also, it's very important to discuss wastewater disposal sector, and this is very important because of prevention of zoonosis and other epidemiological risks. Recovery needs after all in health sector were in a temporary transport of dialysis patients to Belgrade, provision of mental health counseling, increased epidemiological and hygiene surveillance costs, vaccination, urgent replacements of destroyed medicines and supplies, public health information campaigns, and food risks laboratory analysis. And of course, after that, we need reconstruction of destroyed health facilities, repair partially affected health facilities, and replacements of equipment and furniture in health facilities. And of course, the total recovery and reconstructions needs were very high. And after all, we can say that even the situation was very difficult after and during the aftermath of the floods. No outbreak was occurred in affected areas, but I think that it's very important to underline that even today, some people have some psychosocial and mental health consequences because of that emergency situation. And I would like to underline that our famous philosopher and writer said that as soon as he became aware of his power, man began to treat nature as some random and unbearable oddity in the structured order of artificial things in the world, of his own products, which would otherwise without nature be perfect. And I think that it's very important for urban planners to planning really with all according to the all procedures, because of very serious consequences in damages. And to underline that the number of flood events in Europe from 90 centuries until these days, we can see in this map, as well as different kind of flood type composition per region. And we can see that some regions are more than risk from the others. And also that last year, after all, in Europe, we lost more than 300 lives in Europe. So this is the map of some droughts and more than droughts, floods in the globe last years. And it's very important to underline that we need to realize that it's not only because of human, but also because of animal, because of environment. We need to be polite with the planet. And I also want to underline that in post-disaster needs assessment, the first time we have cultural heritage engaged by flooding. And because of that, some key takeaway that we need future health professionals more strength according to the disaster preparedness. And now we have a gap between academia and community partnership, and we need more policy integration and advocacy training. But also recommendation we can recommend integrated with current subjects, build data competencies, co-teach with external sectors, frame floods together with One Health approach, and teach policy advocacy and citizen participation practice diverse community engagement models. And also use different kind of data sets and tools to teach, to exercise, and to increase resilience and better preparedness for future risks. My personal recommendation is use art of water, water in art, and art for water, like some artists today in some museums, for example, in Maxi in Rome, something in the water exhibition, and messages from floods we can use, make the visible, remember, and humanize loss. And a lot of different kind of examples which use some artists in warning and participation. Examples to have some memory and urgency. For example, these drawers after Hurricane Katrina became an archive of loss and a call for just recovery. And also living with water, also different kind of installation and artist work. And we use culture as stewardship through some Confluence project and others. And also I can just for the end underline some projects from my region, from the Balkan region. One day of my birth, how we can respect Danube River, for example, and for the end that we need to be a friend with water, respect the power of water, and overcome fear of water through knowledge, preparedness, and resilience. Thank you.
Thank you so much, Dr. Jeptek, for really sharing your case study experience and those suggestions for how we might teach from these experiences. So now I'll ask Dr. Slovic if she can also join us on camera. And we just have a couple minutes left, so we'll just do one question for each person. And let me just pull up my notes here. So for Dr. Slovic, we have one participant who said they're trying to prepare health system information to collect the right indicators, but the indicators they need, which are used in other countries, are not collectible for them. How would you recommend overcoming this challenge of data collection and the relationship between local, national, and global indicators?
Thank you for this great question. This is really a challenge for most of us. My first question will be where this person from, but which country? just using the Sauerbau example, when the Sauerbau project started, we started collecting, looking at all the data we had available. And that means sometimes not only looking at data, if you don't have data locally, look fine, right? And start building this data set from the local one, from the global ones, I'll say, and then start looking at collaboration across regions, because find you're going to see that other colleagues are having the exact same issues. And if you are in the same region, you're also going to be able to look together and collect this data together. And collecting primary data takes time, but you have to start somewhere. So my suggestion will be that look for this data, see where you can find it in publication and other resources that do not include just the city, and then look at this collaboration and start see how you can strengthen it to build this data.
Thank you so much, Dr. Slovik. And then Dr. Zhevtik, we have one of our questions here is that in 2014, when the catastrophic flood occurred, were there any forecasts beforehand that predicted the above average rainfall? Oh, you're on mute, Dr. Zhevtik.
Thank you. Thank you very much. Sorry. Yes, it's possible to predict, but our urban areas are not fully prepared for this amount of rainfall these days. And because of that, it's not only important to prepare one generation, or we need to long-term preparation according to urban planning. And then we have to educate all generations in continuum. And also much more work on intersectoral cooperation to educate citizens, to communicate between health sector and engineers, hydrometeorological institutions, and be active and also prepared for fast reaction in this situation. And also, I just want to say that some people in 2014 didn't want to go out from their home. This is the mental health attitude and issue.
Mm-hmm.
So it's also very important to be prepared to put everything and have some small amount of documentation for in this in your package for mobilization.
Great, thank you so much. We have reached the end of our time. I want to say thank you so much to all three of our speakers, to Dr. Murray, to Dr. Zhevtik, and to Dr. Slovik. So appreciate your time and expertise in this space. And thank you to all of our participants. And I hope to see you again next week. Thank you so much. Goodbye.